Hi, I'm Kieran. I'm passionate about learning and education. My mission is to help 100,000 businesses leverage digital technologies to make an impact on the world. I do that by helping businesses better understand automation, data analytics, and emerging digital technologies. This helps dramatically improve their operational efficiency and profitability. Now, one of the most important parts of our society is the public healthcare system. Though quite often this industry is overlooked when it comes to talking about shiny new technology like RPA and intelligent automation, but not today. Today, we're going to talk about the public healthcare industry and how the industry is using RPA and data analytics to develop digital ways of working. And these ways of working are massively impacting the healthcare sector, the staff who work in it, and the patients who benefit from it. Welcome, Jincy, to today's interview.
Thank you, Kieran. Thanks for having me today.
Delighted.
It's a pleasure to be here.
Jincy, would you mind introducing yourself and telling the audience more about what you do, your background, and what you're currently doing?
So I work as an assistant director of nursing in infection prevention and control in the Mater University Hospital in Dublin, Ireland. So my prime role is to prevent healthcare-associated infection and ultimately make the hospital safe for our patients, staff, and visitors. And this involves providing expert guidance for all employees and all hospital management in relation to infection control practices. It can be development of policies and guidelines for the hospital, development of tools for auditing and surveillance, and give feedback on those surveillance, bringing sometimes infection control innovations to the hospital and sometimes into the country. For example, Mater Hospital was the first hospital to introduce RPA for clinical nursing practice, and this project received even EPIC Innovation Award in 2021. Another key role I play is in education and training. Most of the time within the hospital and sometimes external. I provide lectures in Royal College of Surgeons in Ireland and Trinity College in Dublin for postgraduate students, and I have been a speaker and chair for various conferences nationally and internationally on different infection control topics, not necessarily RPA. Then another key aspect of my role is I collaborate with the different institutions and tech companies such as National College of Art and Design for development of new innovative medical devices, team up with the Spark Innovation in SSE for their novel projects, and I give infection control advices to them. Currently, I am working together with the experts in infection prevention control from UK for the development of an audit tool. So my role can be quite diverse and it changes according to the needs and infection control challenges of the hospital, such as in COVID surge or monkeypox or flu. And the last 4 years of my career have been the most challenging and highly rewarding. So we expanded our clinical service exponentially. I have a team of 10 infection control nurses who are highly qualified and very dedicated and keen in bringing improvements and changes to the department. So I'm kind of uniquely positioned in the matter to promote further clinical studies and bringing changes to the world. So that's kind of my role in a nutshell.
You're never bored by the sounds of things, I think. Not at all. I don't think there's time. Jincy, in the middle of that, you mentioned about using RPA. Would you mind telling us a little bit more about your use of robotic process automation and data analytics in the Mater Hospital?
So my journey towards RPA started when I saw the administrative workload of my staff. So the Mater Hospital has a legacy lab system that is built in 1980s. So it was a struggle to download these lab results from this legacy system. So they were repetitive and tedious jobs, and the potential for human error was kind of more rich. And because some part of this process requires item needs to be transcribed. And then pandemic placed more pressure on an already stretched department. So we couldn't even collect data promptly on our healthcare-associated infections. So I wanted to establish a comprehensive infection prevention control program in our hospital, and this required time-sensitive data to detect the infections and trends as early as possible to prevent transmissions and ward closures. So at that time, there was no single IT solutions that could provide the appropriate service that we required. So I first heard about RPA in Health Informatics Society's conference in 2019 when Mark O'Connor from UiPath was presenting in the HISI conference on RPA and really got fascinated by the idea. After every slide, I said, I want this in my hospital. So I thought of bringing up this conference, digital innovation, to retrieve time-sensitive data to the department. So, but RPA was never been in use in clinical area to reduce nurses' time workload and save their time. So it was really a trial. So I took initiative to collaborate directly with UiPath. UiPath embraced the project and developed the RPA for our hospital. So now the project is fully supported by HSE's RPA Center of Excellence. So currently, the robot now can analyze and download the lab results from our legacy lab system in minutes and enabling the staff to activate it properly. So the infection control team used to spend more than 3 hours a day in downloading the lab results and entering the lab results in a big database. For example, if the lab results are available at 9 o'clock in the morning, it would take 3 hours for them to complete the downloading process, and they will be acting on those results probably around 12 o'clock, providing the patient information and guidance to the doctors and nurses to the infection control requirement for those patients. So, but now the board downloads lab results. It creates the infection control nurse referrals and write patient-specific information notes on patient management system. So the nurses have the results in minutes rather than after hours. So our clinical nurses' time, the robot also downloads extensive amount of data. And this saved a huge time for the nurses and huge energy. Now the infection control nurses spend more time in the clinical area, engaged in quality improvement initiatives. It improved the compliances, eliminated human error, and it in turn increased staff satisfaction and reduced staff turnover. So now they are focusing more on high value nursing care than ever before. And for me, the availability of time sensitive data on infections and reinfections were very crucial. So the data on all infections facilitated me to check quality improvement initiatives and innovative projects targeted towards reduction of number of patients and occurring infections in the hospital. And the early available data supported me for prevention of outbreak management, prevention further outbreaks, closure of hospital rooms. And so it had a huge benefit overall to the department and to the hospital.
And department, hospital, and patients, because I can imagine they're highly qualified, as you mentioned, clinical nursing staff who didn't go into a nursing career to spend time in front of a computer. I'm assuming they want to spend time with patients, and with the healthcare sector under pressure for all sorts of reasons, their happiness and their capacity both are immensely impactful on infection and patients and patient care and everything else. It sounds like a very successful use of RPA.
Yes, it is very successful, and we are enjoying this RPA service for the last 3 years, and we can clearly demonstrate this in our database because previously we didn't have an extensive data on our own healthcare associated infections. So these infections are patients. I should actually explain what is healthcare associated infection here, isn't it? So these are infections that a patient develops as part of while receiving healthcare, which are totally preventable. For example, in Ireland, every year approximately 6,000 patients acquire infections from hospital while receiving healthcare. Out of the 6,000, around 300 patients die as a result of these infections, which is 0.82 per day, nearly 1 death per day. Now, if you compare this to the number of deaths due to road traffic accidents in Ireland, it's double. Last year, we had 139 people died in Irish road traffic accidents. And if you look at the newspapers and news, each of those 139 deaths hit newspaper headlines or some part in somewhere in the columns, but not the deaths due to infections in the hospital. And these are preventable. So the infection control nurses, it is key for them to have this data, go to the department, give them the feedback, put measures in place to prevent each infections. And the cost associated with these infections are not easily measurable. Some part are easily measurable, some part are not. For example, treating a serious infection after an open heart surgery is around 24,000 euro. And treating a bloodstream infection, which is severe blood infection due to a superbug, is around 24 to 25,000 euro. So in this case, the patient may have extended stay in the hospital, ending between 10 days to 100 days, or sometimes more than that. And then increased length of stay in the hospital leads to increased use of or extensive use of antibiotics to treat those infections, which in turn make these patients more susceptible to more infections. And as part of the treatment, they would also require further lab tests, radiological investigations, sometimes invasive procedures, like occasionally they may end up in getting a second surgery or third surgery. And the impact on the patient, like there's a huge psychological impact of these infections on the patient and families. So we were able to convince our hospital management that the time saved from implementing RPA is going to be redirected to all these additional services like a extensive clinical audit and surveillance, and give the feedback to the team. For example, we do an extensive surveillance on our cardiac surgeries or surgical site infection. So we provide feedback to the team. These are the reasons. This is a preventable infection. Going forward, next step, we are going to take these particular steps to prevent further infection or further death. So, and our time is actually spent now more towards education and research. So, since the introduction of the RPA, we have introduced many innovations in the Mater, not just RPA, and many of them actually received national and international recognition. So, these innovations have saved patient lives, decreased length of stay for those patients, and avoided unnecessary room closures for the hospital.
Oh, wow. And I'm assuming as well, Jincy, that when people are in hospital for longer, then a health system that's already under some pressure, that means that the beds are blocked for those patients coming in, which means the impact outside of the hospital itself is actually more dramatic as well.
Yes. So it has a huge impact on the healthcare system. So if you are avoiding the healthcare associated infections and avoiding the extra bed days in the hospital, you would be able to accommodate more patients who are waiting. So Ireland probably have a huge waiting list for patients to come in. And it's not just in Ireland, any country, if you look, they have a huge waiting list. So this way, there will be, these days, bed days can be diverted towards saving the lives of those people or those who are already suffering at home. We have seen ambulance holding outside our hospitals. Many times it hits newspapers. There are ambulances waiting outside our emergency departments. And if you look at, there are patients in the hospital with preventable infections. So we need to draw a balance, get them home early, alleviate their suffering, and get the patients who are suffering outside the hospital, bring them in and treat them.
So, Jincy, how do you convince a hospital budget owner, the CFO, that she needs to release funding for robotic process automation to all of the hospitals to allow them to do something to prevent infections across Ireland or across the UK as well?
So there is always a pressure on healthcare budget to provide quality of service and given within the given allocation. And it is important to analyze the avoidable spending. So to give to assess the avoidable spending, you need to have a data on what are the reasons or where are these infusions happening. That's what RPA helped us to do. So it helped us to enable to assess the data on infections and reinfections. And we were able to demonstrate to the hospital management that if we prevent these infections, these many bed days could save. And that actually increases the saving for the hospital budget. And the hospitals also look for quality improvement. They need to provide a quality services to their patient. So it's there in the best of interest to improve patient safety and be cost effective. Now you have an employee. Imagine this is an employee. RPA is sitting in the background and working for you 24/7, 365 days without a break requirement. And it actually enables fluctuations, balance the fluctuations of work. During the COVID time, we had the height of patients admitted to the hospital, like hundreds of lab results on hospital, maybe more than thousands a day. Our robot was able to capture those. So the bot is not affected by fluctuations at work. The bot doesn't require any annual leave. I usually joke that this is one employee who doesn't have any special request of maternity leave or parental leave. So continuously that person is sitting in the background and working. So I think the more awareness you need to make to the CFOs, once they are aware of the benefit, they will embrace it.
Yeah, I like that, that there's a money element in there as well. There's a preventable death element, which is the most critical. There's the patient psychology or psychological safety, the medical staff benefiting as well. That in itself must be immense, because you do not want to see turnover of staff either.
Yeah.
How do you build a sustainable approach to not only build the robot or robots, Jincy, but to keep that momentum going, to keep spreading more automations across the hospital? What are you doing in that regard? Who's helping, or are you doing it all yourself?
So the sustainability, the first step is actually to identify the process that are suitable for automation. Like identify the process that are time consuming, repetitive, rule based. They are the good candidate of RPA, and our process was the best example. It was time consuming, repetitive, not at all an interesting task to do. That's not what the infusion control nurses were trained for. So it was important for us to have that role automated. So if this, and again, this should be prioritized as per the potential impact on the organization and the ease of automation. Secondly is to get the buy-in from the key stakeholders. Talk to them very early in the planning stage and assess the impact of RPA on their department. Then build an RPA strategy. Once the processes have been identified, then the strategies needs to be baseline, developed as part of the goals and timelines and resources required for RPA implementation. Sometimes you don't have your own department. For example, my team is all infusion control nurses. None of them are techie people. So to talk to them about RPA, they all welcomed it because they wanted to get rid of their tedious administrative workload, and they would love to do their high-value job. So it's important that you have a strategy outline and that is aligned with the overall business objectives. Then it is the selection process. I'm trying to recall what I did at the beginning, and then it was the selection of the right RPA tool. You may not be an expert in the field of RPA or AI. There are many RPA tools available in the market, so probably talk to the expert in the field who could actually help. Like in R&D, we have RPA Center of Excellence who provide the support and development. And there are many other institutions across different countries. NHS UK also have their own RPA Center of Excellence. So talk to those people, get the right tool that suits the organization requirement or that suits the requirement of your team. And with the use of scalability and cost should be considered, because it should be manageable. Another key learning point I have from our project is to train the staff and key stakeholders. So they should be trained to use the RPA tools, and they should be able to use to improve their workflows and efficiency. So this will ensure that every stages of everyone is on the same page and they can actually contribute towards the success of the RPA implementation. And you should also monitor and evaluate the performance. Majority of the time, it's important to give that feedback to your own department and to the hospital management what the robot is actually doing, and evaluate the impact of RPA on the organization. That actually gives buy-in support from the hospital management, and you'll be able to identify the areas that need more improvement and more RPA. So the more you are interested in RPA, you'll actually deploy more projects towards RPA. Another major concept is that you try to continuously improve and optimize outcome. General concept so far, I've spoke to many people who are actually in the RPA, and they think once you are implemented RPA, that's done and that's you don't have to do anything. But that's not the true. Healthcare is so much changing in every day. So you actually have to have an ongoing process of evaluation and optimize outcome. So use the right RPA tool, optimize the RPA tools what you are currently using, and ensure that the process that you have already started remains as effective and efficient.
Jincy, what advice would you give to hospitals or healthcare workers who are thinking about implementing digital RPA, data analytics, intelligent automation? Where would you recommend they start?
So as I mentioned just now, the starting point is the best identification of the process that can benefit from automation. So if you have a repetitive, rule-based, time-consuming task, I would automate that one, the first one. Can you explain the process to someone who is not experienced in your field in a step-by-step process? If that's the best step to start with. If I can explain my job to someone else to do that for me in a step-by-step work without much of intelligence required there, that would be the easiest one to take on board. Now, I'm not saying that intelligence is not needed, because RPA can do much more and the AI can actually do much better than certain human brains. So I'm actually talking about the basis. So what I did was actually process mapping. So process mapping helped to identify the process that can be automated through RPA, and also it provides clear understanding of the process and steps and dependencies, and which are essential for RPA implementation. So when I did the process mapping, it actually identified the potential risks and challenges associated with RPA implementation. I clearly remember the people who were doing process mapping with me, they actually analyzed, I run the process in the computer, and then they analyzed it and they stopped me between asked, you went from screen number 1 to screen number 2, but there was a pause for 3 minutes. What you were doing in that 3 minutes? And that was questioned. So that was a human intervention that was needed at that time to analyze the text that was in the screen. So it's important to do that process mapping. Can this be automated? And if that can be automated and remove the requirement of human intervention or decision making, that would be the most appropriate project for automation. So that would be the first step. Identify the proper project.
I like that. And for those listening in, is RPA difficult, Jincy, or is this something that everybody can do? Because we've heard RPA and intelligent automation and data analytics and process mapping, and that could put some people off who maybe fear technology. Is it scary, or is it actually everyone can learn this?
No, it's not scary at all. When first I heard about RPA in the conference, you just need to have some understanding that it is a bot that is going to help you. It's not going to take away your jobs at all. You talk to the people who are already doing RPA. Once you talk to them, you will really get fascinated by the idea. You'll be blown away, because the more they have one bot, they want to get more bot and more and more. It's like getting money, you want more bot and more. So all the, like, I probably have under 5 or 6 projects that can actually waiting to be lifted from us to the board. So you have an understanding of what is RPA. It's not going to invert into your space. It's a personal assistant. I call it as a personal assistant, or an assistant to our infrastructure control team, to take away the work that they don't really need to do, but they are necessary, because many of these administrative work we do are necessary, are mandatory, but some of them are necessary for us to drive the services. But these can be done by bot in an easier way. So I know we are healthcare workers, and some of them are very skeptical in bringing change, because we learned it's a patient data, patient confidentiality. We always need to maintain patient privacy. Is it sitting in the cloud? Are they going to take the information from the cloud and going to misuse those information? So all these things comes into a healthcare worker's mind, because we are very protective of our patients. I think now there are systems in place, a legal requirement of data protection. So you can actually talk to the hospital's data protection manager, hospitals' IT systems. They are all people surrounded by you to help you to bring innovation. So don't be scared.
Excellent. Jincy, if people want to find out a little bit more about you or the work that you do, how could they go about doing that?
The best way to get me is on my email, Jincy Jerry, my full name, Jincy Jerry at mater.ie. So JINCYJERRY@mater.ie. And you can find me in the Twitter. I'm not a big user in LinkedIn. I'm planning to start. You think like you're a master of RPA, and you don't even have a LinkedIn account. I promise I'm going to make one.
I'm not too sure if it's a exam pass for LinkedIn, but both seem to be connected. Jincy, that's excellent. For those listening in, they must come away from this interview so positive that everything is possible, as long as you understand the logic behind your process and you can describe that to others. And if you can do that, you can put in RPA. And as you mentioned, it's not the fact that the work is routine and monotonous or dull or repetitive. It's vital work. But just because a person can do it doesn't mean a person should. You can use robots to automate that work, to free the staff, as you mentioned, the well-qualified, highly trained, highly patient-centric staff, to spend time actually on the clinical work that they most enjoy, the research, the analysis, the tracking down and preventing of diseases. Because as you mentioned there, infections cause thousands of patients to stay longer in hospital. The 300 deaths, shocking figure. As you mentioned, car deaths appear all the time and they're tragic, but it's almost double the figure you're describing. And the business case that you're describing as well, all the benefits that come out for those preventable deaths, for the psychological safety of the patient and no doubt their family, and for the medical and mental health well-being of the medical staff as well. It sounds like something everyone should be doing. I congratulate you on all of your achievements, and I can't wait to come back in a number of months or a year's time to check what else you have done. Thank you so much for sharing your story today. It's amazing to hear a healthcare RPA automation story come out when normally we just hear about banks and building building societies and something else. Nothing against them. It's just wonderful to hear a unique story. Thank you so much indeed.
Thank you, Kieran. Thank you so much. Have a good day.